This is the finished look of the earrings and the bangle. I hope you've enjoyed this tutorial. The month of July is plastic free, so I am encouraging you to reduce the use of single-use plastic.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country above self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they're out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gone locked down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Everybody beware, and you better prepare. Disaster can happen anytime, anywhere.
International news sources such as CNN, BBC, or the Weather Channel are great sources of global weather news. However, you should not rely on these sources for making life and death decisions. NEMA will collaborate with the Met Office to bring you the local forecast, which will have the type of information you will need to make critical decisions. Listen to the local forecast. A message from NEMA.
You better prepare. Disaster can happen anytime, anywhere.
The symptoms of the coronavirus are similar to those of the common flu or cold, which are consistent coughing and sneezing, fever that does not go away, and difficulty breathing. If you are experiencing any of these symptoms, it is advisable to stay at home until you recover, or if you want to go to your doctor, call first and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that.
Good afternoon and a pleasant welcome to the National Emergency Operations Center COVID-19 weekly briefing for the 14th of October 2020. We are pleased to be here again to update you on what is happening in the Federation of St. Kitts and Nevis in relation to the COVID-19 global pandemic. We continue to provide you with pertinent and relevant information as we continue to manage here in St. Kitts and Nevis the pandemic. So thank you again for being with us, for joining us for today's briefing. I would like to invite Superintendent Cromwell Henry, the Divisional Commander for District A, to bring us his presentation. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all who are listening to or viewing this broadcast. Now, this afternoon, I know I spoke about quarantine last week, but I think it is important that I continue to speak about quarantine because it is a very important measure that will help to keep us safe upon the reopening of our borders. As the borders reopen, public health authorities will be required to put measures in place to prevent the spread of the coronavirus. We have been told that we must expect the re-entry, or we can expect the re-entry of the virus upon reopening, and that the second wave is likely to be more impactful than the first wave. The Chief Medical Officer and the National COVID Task Force have recommended a number of measures to protect us and to prevent the spread of the virus. All of these measures are contained in various pieces of legislation and therefore have the effect of law. Quarantine is one of the means to prevent the spread of virus. From the feedback we are getting so far, particularly from nationals who are planning to travel or those who are returning, suggests that there is some resistance to this measure. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. It helps to prevent the spread of the disease that can occur before a person knows they are sick or if they are infected with the virus without feeling symptoms. People in quarantine should stay at home or at a designated place, separate themselves from others, monitor their health, and follow directions of the health authorities. All travelers entering the Federation will be required to quarantine for 14 days, unless you are traveling from a country that is considered low risk. This quarantine can either be at a designated site or at your residence, subject to approval of the CMO and the National COVID Task Force. I must emphasize that home quarantine has to be approved before entry, and the terms and conditions associated with this quarantine must be agreed to before it can be permitted. Again, we remind residents that all the measures that we recommend, quarantine, wearing of masks, sanitization, social and physical distancing, are intended to reduce our risk of contracting or spreading the virus, and so we urge your full cooperation. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Hazel Laws, Chief Medical Officer for the Federation of St. Kitts and Nevis, to give us the Health Emergency Operations Center situation report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center situation report for today, Wednesday, October 14. On October 12th, the WHO Director General, in his opening remarks, said, and I quote, "Around the world, we are now seeing an increase in the number of reported cases of COVID-19, especially in Europe and the Americas. There has been some discussion recently about the concept of reaching so-called herd immunity by letting the virus spread. Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. The response to the pandemic requires a comprehensive approach using every tool in the toolbox," end of quote. what's the situation on the ground here in St. Kitts and Nevis? At present, we would have reported 19 confirmed cases of COVID-19, and it's with much joy I update you that all the cases have recovered. So all 19 cases have recovered. So yes, the Federation, we've reported 19 confirmed cases of COVID-19 to date, and they've all recovered. In the CARFA member states within the Caribbean region, over 45,000 confirmed cases of COVID-19 have been reported, with over 31,000 recoveries and only 899 deaths. Just to give you an idea as to what's happening in the islands, the neighboring islands. So Anguilla, they've only reported 3 cases so far, Montserrat 13, Grenada 25, Dominica 32, St. Lucia 29, St. Vincent and the Grenadines 64, Antigua and Barbuda 111. Barbados reported 208 cases to date, Turks and Caicos 696, Guyana over 3,000, Trinidad and Tobago a little over 5,000 confirmed cases, and Jamaica a little over 7,900 cases. So that just gives you an idea as to what's happening in our neighboring islands. In the United States of America, there are over 7.8 million confirmed cases, and the death toll has surpassed 215,000 to date. And based on the news this morning, they are noting a surge in cases in 33 to 36 states throughout the United States of America. And so there is a surge in cases in the USA. What's happening globally? So as at today, this afternoon, over 38 million confirmed cases internationally, and well over 1 million deaths so far. In St. Kitts and Nevis, we continue testing. At present, we are mainly focusing on the returning nationals, and so over 2,600 persons have been tested to date. We continue receiving nationals, or nationals being repatriated, and so between April the 24th to today, October 14, a total of 463 nationals would have returned to the Federation. As we speak, a team of health professionals are presently at the Ross University School of Veterinary Medicine campus, whereby we are receiving a total of 155 students who have returned to the Federation. So 4 flights would have just landed. I think one from Miami with 135 persons, and about 3 flights from San Juan, Puerto Rico with approximately 20 persons. And so a total of 155 students would have returned to the Federation. So this is the 4th batch of students, and so they are being tested upon arrival. Now let me back up. So they would have been tested within 72 hours of boarding their flights today, and those results were all negative, and so they were granted permission to board the flight to the Federation. And so upon arrival, their samples are being taken as we speak at the Ross campus, and then the samples will be processed. They go into compulsory quarantine for 14 days. They will be tested again on day 14, and once their PCR test is negative, then they will be free to integrate into the society. And so this is our 4th batch of students returning to the Ross University School of Veterinary Medicine. Okay, so this afternoon I wanted to reiterate the health and travel related entry requirements that comes into vogue as at October 31st of this year. So, ladies and gentlemen, on October 1st, the Honorable Prime Minister would have announced that our borders will reopen on October 31st to international travelers, tourists, and we will continue accepting our locals or nationals or returning nationals. Now, our aim is to reopen our borders safely with minimal or minimum risk of reintroduction of the virus to the Federation. And so we want to reassure you that appropriate protocols are being developed to ensure the safety of our people and the safety of the inbound traveler or tourists. And so phase 1 begins on October 31st. And so in phase 1, all inbound travelers to the Federation will be asked to log on to our national website when the website will be launched in short order. And so persons will be able to log on and complete the entry form, providing the specific details like your passport, ID page, travel date and travel details. And we are also asking that you upload a negative COVID-19 PCR test. Now this test should be done within 3 days of travel. Now we've attended some regional meetings and we have been assured that persons within the United States of America, they now can access PCR tests and results within a more timely manner. And a number of our returning nationals, they have been successful in getting this test done within the 3 days of travel. Now, all inbound travelers to the Federation will fall into 2 categories. The first category will involve those travelers coming from within the Caribbean bubble, with minimal risk of exposure to the COVID-19 virus. And so this includes persons coming from 8 Caribbean islands, including Anguilla, Antigua, Barbuda, Montserrat, Dominica, Grenada, St. Lucia, St. Vincent and the Grenadines, and Barbados. So those are the 8 Caribbean territories. So individuals coming from these islands, you will be deemed as having minimal risk of exposure to the virus, and so that's the first category. The second category will be those coming from outside of the Caribbean bubble, and so you will be considered having a more significant risk of exposure to the virus. So what happens to you if you are coming from the Caribbean bubble? And so these are the 8 territories listed on the screen. Now, once you traveled directly to the Federation from any or from either of these 8 territories, right, where you resided for at least 21 days, right, and once you would have submitted a negative PCR test, once you land at RLB International or Vance Amory Airport, you will be screened. And screening here means you will be asked questions regarding the onset of COVID-like symptoms, and your temperature will be taken. And so once you're asymptomatic, once you do not have any symptoms, once your temperature is normal, you will be allowed to integrate into our society. Now, persons in this category, you will also be asked to upload the National COVID-19 mobile application on your phone. And so we can monitor you for the first 14 days while on the island, if your vacation, is for that duration. And so again, once you are without symptoms, and you're coming from the Caribbean bubble, you can integrate freely into the Federation. One very important point, if you're an inbound traveler from one of the 8 islands included in the Caribbean bubble, you can stay at a private home, private residence, or you have the option of staying at one of the non-franchise hotel properties. So you can stay at Timothy Beach, Sugar Bay Club, Nevis Golden Rock, Paradise Beach Hotel, Mount Pelia, Plantation, Nisbet Plantation, Hermitage, Mount Nevis Hotel, and the Pinnis Beach Hotel. And so you have a wide array of hotel properties open to you if you're coming into the Federation from the Caribbean bubble. Please note that all arriving passengers from within the Caribbean bubble who have been in transit in a country outside the bubble, you will be considered part in the second category, whereby you will have to vacation in place for 14 days, or for the duration of your stay. Okay, so now let's look at the second category of inbound traveler. So if you are an international traveler, tourist, or a returning national from any country outside of the 8 Caribbean islands previously mentioned. So in other words, if you are coming from Jamaica, if you are coming from Trinidad and Tobago, if you are coming from the United States of America, if you are coming from the United Kingdom, if you are coming from further afield, Canada, or any of the European countries, or the Eastern countries, you will find yourself in this second category. So there will be several COVID-19 approved accommodation options open to you. All right? So if you're a returning national, you can stay at the Ocean Terrace Inn, you can stay at the Royal St. Kitts Hotel, you can stay at Oali Beach Hotel, or even Portworx in Nevis. You can also, if you already have a villa in St. Kitts, or if you already have a home in St. Kitts, your home can be assessed and can be and once it meets the requirements of this pre-approved or pre-certified confinement site, and once you are willing to pay for the security facility, your villa or your home can be a site where you can vacation in place. Yes? And thirdly, if you are an inbound traveler, an international traveler, a tourist, you can stay at one of the franchise or branded hotels in the Federation of St. Kitts and Nevis. So these are the options open to you if you're an international traveler coming from outside of the 8 previously mentioned Caribbean islands. The inbound traveler in this category is asked to submit a negative PCR test done within 3 days of boarding the flight to the Federation. Please note that this test must be done at an accredited laboratory. And again, this test must be the PCR COVID-19 test, not the antigen rapid test and not the antibody test. We are expecting you to submit a negative PCR test. The traveler will be screened at the airport when landing, upon arrival, you will be asked to upload the St. Kitts and Nevis COVID-19 mobile application on your phone, because we'll be monitoring you for the first 14 days of your vacation in place. So when you arrive at the Robert Llewellyn Bradshaw International Airport, as I said before, you will be screened in our newly recommissioned health station at the RLB International Airport. And so when you arrive at the health counter, you will be asked a series of questions to ensure that you are not experiencing any of the COVID-19 related symptoms. Your temperature will be taken. So once you're without symptoms and you've completed all that I've just said, you will be granted permission to enter the Federation, and you will be allowed to vacation in place at your hotel with access to an approved package of services in a secure bubble for the first 14 days or for the duration of your stay if it's shorter than 14 days. The international traveler, tourists, will be required to do serial testing, meaning serial COVID-19 tests. And so if your stay is longer than 7 days, you will be tested on day 7. And if your stay is longer than 14 days, you will be tested on day 14. So tourists who receive a negative PCR test on day 7, if they're still vacationing in place, you will be allowed through the hotel's tour desk and by appointment only access to selective excursions in a secure bubble, and you can also have access to selective tourist attraction sites on the island in a secure bubble. So in other words, you'll be allowed to move from the franchise hotel in a secure bubble on an excursion that's approved, or you will be allowed from the franchise hotel to a selective tourist attraction site in a secure bubble, and then you go back to the hotel. All inbound travelers must receive a PCR test on day 14 if your vacation exceeds that period. So if your PCR test is negative on day 14, then guess what? You'll be free to integrate into our society. If your trip or vacation is less than 14 days, you can easily depart the island with an exit test if that's required. Now, tourists, international tourists, travelers in this category, please note that you can only use COVID-19 certified taxis or ground transportation with appropriate partitions in place to move between the airport and the franchise hotel, and to move between the hotel and the excursion or the tourist attraction sites. So now that explains phase 1, and we are getting a number of questions as to how long, what's the duration of phase 1? Well, everything about COVID is unpredictable, but we are estimating maybe 1 month or 2 months duration in terms of phase 1. Again, it depends on, if we have a surge in cases, it depends on a number of factors. But for now, we are estimating probably 1 to 2 months as a ballpark duration for phase 1. Phase 2, or the second phase, will involve an expanded list of hotels. And so such hotels would be required to submit the appropriate protocols to ensure safe operations and minimal risk of COVID-19 outbreak on the hotel properties. The second phase will also involve an expanded list of excursions and local tourist attraction sites. Again, the operators and the owners will be required to submit appropriate protocols, the relevant protocols. Ladies and gentlemen, so we are preparing to open our borders on October 31st. And yes, the Ministry of Health, the COVID-19 Task Force, and all the stakeholders, we are working real hard to do so wisely and safely. However, the responsibility, it's an all of society responsibility. And so you, the general public, everyone, everybody in St. Kitts and Nevis, we have a part to play as we prepare to open our borders. Because once you open our borders, the risk of reintroducing the virus increases. And so each of us, we all have a responsibility to play in terms of reducing our own risk of exposure to the virus. And in so doing, we will prevent, we can all work together to prevent a second wave of infections. And so all stakeholders must adhere to the infection prevention and control measures that are being shared as we speak. These measures are meant to ensure safety of our frontline workers. And when I say frontline workers, I mean frontline workers within the arrivals aspect of the airport, frontline workers in terms of immigration, customs, health, or taxi and tour operators, the front desk staff at the hotels, the persons who will be working on these excursions and at the local attraction sites. All right, so we all have a part to play in terms of adhering to the infection prevention and control measures, all right, to ensure our safety, safety of our people, and safety of the inbound traveler, tourists, and returning national. Ladies and gentlemen, we must all wear our face mask when in public spaces. This is critical. And this is, some of us, we've gotten lax, but we really need to take this on board. All right? And leading up to October 31st, we need to wear our face masks. You know what I do? I wear sexy looking face masks. All right? So whatever you need to do to encourage and motivate you to wear your masks, please let us wear our face masks. Yes. We must always maintain good hand hygiene. All right? We need to keep our hands clean with soap and water and our alcohol-based sanitizers. We need to keep our hands clean, keep our hands from our eyes, nose, mouth, please. We need to maintain our physical distance. We need to maintain our physical distance. And I say 6 feet because some of the international organizations say that it can be, we need to maintain a distance of greater than 1 meter or 3.3 feet. But in following CNN on the weekend and these super spreader events in the United States, some of these events were in open air. And so it's important to maintain a distance of 6 feet at least. That ensures you are protected. And we all have an individual and collective responsibility of avoiding crowds and events where a number of persons are gathered. And so now if you're following the news, you are hearing about these super spreader events. So really and truly, we shouldn't be organizing any super spreader events, and we all have a responsibility to stay away from these super spreader events now and even more so after October the 31st. On a different note, dengue. There are a number of islands, neighboring islands, that are reporting confirmed cases of dengue. And once our borders open, we run the risk of having cases locally. So at present, our vector control officers, they are working very seriously in terms of source reduction and even fogging and spraying to reduce the mosquito densities. And so as a means of reminder, again, we all have a collective responsibility in terms of preventing a local dengue outbreak. And so we are advised to stock up on a good mosquito repellent, eliminate standing water in and around our homes. And so yes, we've been getting some good rainfall, and the water settles in empty, dirty containers in and around our homes. We need to walk through our homes at least once a week and rid ourselves of eliminate standing water. Make sure our screens on the doors and windows are intact so that the mosquitoes stay out. Wear protective clothing early morning and at dusk. Again, just some additional reminders. You could even sleep under a mosquito net. So remember, prevent mosquito breeding sites in and around your homes. So that's the take-home message. Empty, clean, or dispose of containers that hold water in and around your homes. I thank you.
Thank you very much, Dr. Laws, for your comprehensive presentation. I now invite Mr. Abdias Samuel, who is the chairman of the COVID-19 National Task Force and the National Disaster Coordinator, to give us his presentation. Mr. Samuel.
Good afternoon, and thank you, Mr. Williams, and to all our viewers and listeners all around the world and locally, regionally. Before I start today, I just want to highlight some information that I received while awaiting my opportunity to address you. And this is a report, a press release, by the Department of Health and Wellness in St. Lucia. It says that today, as of today, Wednesday, October 14th, 2020, St. Lucia recorded 2 new cases of COVID-19. The individuals are a couple, a 38-year-old female and a 47-year-old male of Castries. They both developed respiratory signs and symptoms, which led them to seek care at a community respiratory clinic on Monday, October the 12th, where they were treated for their symptoms and tested for COVID-19. At that point, they did not report risk exposure to COVID-19. Again, let me repeat. At that point, they did not report risk exposure to COVID-19. As per protocol, they were sent home for isolation, awaiting results. Upon receiving their confirmed COVID-19 results, arrangements have been made for their transfer to the respiratory hospital for care. Their son, who is a secondary school student, shall be assessed and tested for COVID-19 and placed in quarantine. The classmates and teachers shall be assessed and will be kept in home quarantine until these test results are received. Contact tracing has commenced for the possible contact of these 2 new cases. That's how much impact 1 or 2 single cases can have on a country. It's very important, very, very important that we adhere to the protocols that are being recommended. Today, I just want to be brief and highlight just a few things. I want to speak to the civic responsibility that we need to exercise in doing our part. In particular, as we endeavor to maintain the status of a low-risk country here in St. Kitts and Nevis. How can we achieve this? 4 critical things I'm going to highlight today. We need compliance by our business and corporate partnerships. We need staff development, continue the public-private partnership, and infrastructural enhancement to safeguard the staff first and the customers. The public response is very important. It's going to require a cultural change and adaptation to the new norm. It's also going to require a strict adherence to the non-pharmaceutical measures, as was just stated, the wearing of the mask, hand hygiene, and staying away from events that can be super spreaders. 3, supporting the legal framework being used to prevent the spread of the COVID-19 virus. And these are critical elements that are needed. And I want to highlight by saying that any individual with a neglectful approach to combat the spread of the disease will only regress the progress made in the fight against the virus. Let us not allow ignorance to regress the progress we have made together. It only takes a single exposure of one citizen to take the country into regression. On a lighter note, I wish to continue my invitation to all of our citizens, residents, and visitors to our week of activity. Yesterday, we would have seen an address by the Honorable Wendy Phipps, co-chair of the Mitigation Council and the International Day for Disaster Reduction. And the theme for that day yesterday was it's all about governance. We have seen, and I keep saying it, once you have good governance, you have a great chance of defeating the virus. So tomorrow, I'm inviting all to support NEMA and its partners in the Family Feud. The Family Feud will take place tomorrow evening, and we are asking all to come out and cheer for the team that will represent NEMA. We will also continue with our Face of the Districts and our trivias. Please log on to our website at www.nema.kn. And Friday will be our day, our staff development day. You are invited to pass through NEMA, engage with the staff, talk with us, and if you want to share a drink, non-alcoholic drink with the staff, you can bring them and do so. Right, Vesta? On Saturday, there will be a volcanic hazard tabletop exercise for the NEMA districts, and this is a way of testing our volcanic preparedness plans and also involving the districts at the community level to be prepared. So the general public, there is nothing better than having a well-prepared country to respond to the effects of any type of hazard. It is said, again, and I will repeat, as I repeated on Sunday, if it's not risk-informed, then it has a human cost. If it's not risk-informed, it has a human cost. And I am certain we don't want a human cost, and this is why we have been fighting really hard, working really hard to ensure that we defeat the COVID-19 virus, and we will learn to exist and coexist with it. We are in the Atlantic, we are experiencing a tropical disturbance that is traveling north-northwest and through the Caribbean chain of islands. Associated with this disturbance will be some moderate to heavy showers within the next 24 hours, accompanied by thunderstorms. So tomorrow morning, if you wake up and you see the lot of rain, you hear the lot of thunder, lightning, and you may experience some gusty winds, it doesn't mean that we are going to close down the country. It means that I want you to remain vigilant, observant, and listen to all the necessary warnings and precautions that will be provided by our local Met Office and also by the National Emergency Management Agency, NEMA. Again, log on to our website, go to our Facebook pages, and stay informed. Listen to our local radio station for any information. Once we receive heavy showers, I'm asking road users, whether pedestrian or motorists, to exercise caution in passing by these waterways. You know the known waterways here. So please exercise caution not to park in these areas and the areas that are known to have the potential for landslide and rockfall, exercise caution. If you can avoid them, avoid them. If not, please proceed with extreme caution. I want to take this opportunity to thank the Emmanuel Methodist Church in Sandy Point for the excellent job they did in hosting us on Sunday during the church service, but most of all, the implementation of the protocols that they have in place. It was evident with the pressure checks, the temperature checks. I think pressure maybe want to check for real, Dr. Lars, yeah? For example, the temperature checks that was done, after the temperature checks was done, you were logged in a book, and your temperature, your name, your contact information, which is for traceability. There were markings on the ground for the spacing. The seating were properly spaced, so therefore it will minimize the risk of you coming in contact with anyone that may have had the virus. I want to thank the Christian Council and Evangelical Association for their partnership. Now, considerable amount of work is being done at the RLB International Airport, and we are hopeful that the same will be done in the ports of entry by sea, at the seaports and the various marinas. We should be holding dialogue with our marina operators and also with the yachting community as we seek to also strengthen the inbound passengers via the sea. That is very critical. Again, thank you for listening. We are preparing. We need the general public to come on board and support our efforts in opening our borders. There is no fear. We shouldn't have no fear. What we should have is a well-prepared citizenry, our residents, our visitors, and we ensure that persons adhere to the protocols. Once you do that, I think we can be good in receiving our persons. Allow me to also welcome the Ross University students. I must highlight that the Ross University of Veterinary School has been doing a wonderful job in collaborating with the National COVID-19 Task Force, collaborating with the local authorities in helping us to stimulate our economies, creating economic opportunities and activities, and also in facilitating those students who need to complete their education. We have learned a lot from them, they have learned from us, and I'm certain that the lessons out of these engagements will help us prepare for what is to come when the borders open. So let us continue that equilibrium between the health and the science and with the creation of economic opportunities and activities. Thank you very much for your support, our beloved citizens and residents, and I hope that we continue to remain vigilant as we will endeavor to open the borders on the 31st of October. Thank you.
Thank you very much, Mr. Samuel. That brings us to our question and answer segment for today's briefing. I will start the questions for today. Now that the borders are reopening, can we get the number of rooms available for quarantine, and how many rooms are available at the various institutions for the short-term stay for quarantine? Dr. Laws.
Okay, so international travelers, tourists, as I said, you'll fall in the second category, and so you'll be able to log on to the site and you can stay at the branded hotels. And so I really do not know the capacity at the branded hotels, Mr. Mr. Williams, because, you know, those are open to the inbound traveler. The O'Halley Beach Hotel and the Royal St. Kitts Hotel will also be accepting inbound travelers at this time. And so the facilities that we are using now also includes OTI and Potworks. All right, and so each of these establishments, you know, have their, you know, capacity. I can't speak to the capacity of the individual facilities.
Thank you very much, Dr. Laws. Before we proceed, we would just pause for the playing of a video which has to do with the border reopening.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. Therefore, self-health management is an important step in this process. Self-health management refers to the measures people take to manage their own health. You and I should remember to wash hands often with soap and water, or use alcohol-based hand sanitizer. Avoid touching your eyes, mouth, and nose. Take your temperature morning and evening. Watch for symptoms. Persons with diabetes or hypertension are reminded to take your medication regularly as prescribed. If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear a mask at all times. If you develop symptoms, put on a mask and seek medical care. Do not take public transportation. Inform the doctor of your travel history, any contact with confirmed or suspected cases, your occupation, and whether anyone around you has similar symptoms. If you become ill, please rest at home. Wear a mask and isolate yourself from others in your household. If you share a bathroom, disinfect daily using 1 part bleach to 10 parts water. Everyone must work together to reduce the spread of the coronavirus when our border has been opened.
Okay, welcome back. We continue with our questions. These 2 questions are from Von Radio. Last week, it was mentioned that the prices for persons quarantining at a number of hotels upon their arrival. Can you also give the cost for returning nationals, as persons are eager to return back to their home? And the second one, Barbados has recently welcomed the option of tourists staying on the island for work or to study, which will or can generate more income for the island. Can we implement such an option in the Federation as well? Dr. Laws.
Okay, so Mr. Williams, 2 good questions. In terms of the prices for persons who would be vacationing in place, I would prefer to use that term. Now, if you are going to any of the branded hotels, you will have to call the front desk reservation, and then you will be given the cost for vacationing at that location. So if you're going to opt to go to Royal St. Kitts Hotel or Oali Beach Hotel, you call the front desk, make a reservation, and then you will be told the cost. OTI, I can provide you. The cost remains $500 for the duration of 14 days. Yes, and then of course there is a $100 fee for the PCR test at the end of 14 days. And if you're an international traveler staying at one of the franchise hotels, you will be tested, serial testing, day 7 and day 14. And so that provides you an overview of the costing in terms of where you will be vacationing in place. Now, in terms of the other question, Barbados is really targeting visitors, tourists with who will be on island for a longer duration of time. And so in the context of COVID-19, you know, that target group is the preferred target group, meaning tourists who are willing to come into country for a prolonged period of time, meaning 3 weeks, 1 month, or even beyond. And so a number of persons the world over, they are working from home, they are working virtually, and so you can opt to leave New York or Miami or London and, you know, work in a villa, a hotel room in St. Kitts, Nevis, and stay with us for 2 months, 3 months, 6 months. And so that's the preferred guest or tourist that we would be, you know, that we should be targeting. Persons who are here for a longer period of time. Thank you.
Thank you, Dr. Laws. That brings us to the end of our question and answer segment for today and the end of our NEOC COVID-19 weekly briefing for the 14th of October 2020. Thank you very much for joining us today. Thanks to Superintendent Henry, our CMO, Dr. Hazel Laws, our Chairman of the COVID-19 National Task Force, Mr. Abdias Samuel, our Medical Chief of Staff, who is here with us as he always is, to Vesta Southwell for her support. We thank the ZIZ team, and we continue to thank all the media in the Federation for partnering with us. We also thank our dedicated sign language specialist, Mrs. Christmas Jacobs, for being with us today as well. Thank you very much, and we will see you next week, Wednesday, for another briefing. I am Les Roy Williams.
Thanks to the this strategy requires effort on everyone's part. Therefore, self-health management is an important step in this process. Self-health management refers to the measures people take to manage their own health. You and I should remember to wash hands often with soap and water, or use alcohol-based hand sanitizer. Avoid touching your eyes, mouth, and nose. Take your temperature morning and evening. Watch for symptoms. Persons with diabetes or hypertension are reminded to take your medication regularly as prescribed. If you have no symptoms, you may carry out your normal routine and boost your immune system. When you are outside, avoid public spaces and wear a mask at all times. If you develop symptoms, put on a mask and seek medical care. Do not take public transportation. Inform the doctor of your travel history, any contact with confirmed or suspected cases, your occupation, and whether anyone around you has similar symptoms. If you become ill, please rest at home. Wear a mask and isolate yourself from others in your household. If you share a bathroom, disinfect daily using 1 part bleach to 10 parts water. Everyone must work together to reduce the spread of the coronavirus when our border has been opened.
Is on.